I'd like to start by introducing you to Erica. Erica looks a little bit stressed out here because she is. It's the end of a long day, and right now she's looking at the list of pet owners she needs to call back before she can go home. And she knows several of these people she's already talked to at least once today. And she sighs to herself. She's not sure what she finds more difficult, the owners who call repeatedly asking kind of the same question or different variations of it, or the owners who don't follow treatment recommendations, and now they're calling in a panic because there's an emergency. She looks up at the clock. It's already 30 minutes past quitting time. But earlier, she wasn't able to just walk away from Mrs. Kendrick, whose golden retriever, Prince, has just been diagnosed with a large cancerous mass. Erica knew that Mrs. Kendrick's husband passed away this last year, and Prince is her everything. So she sat with her a little bit longer than usual. She was pulled away from her computer by a loud voice coming from the lobby, a woman saying, "What? I can't afford this." And she looked around the corner to see a woman staring down at the customer service representative who looked a little frightened. And the woman was demanding to speak to a manager, saying, "I want her to come out here and tell my son to his face that his dog is going to die because you all care more about making money than saving his dog's life." Erica looked at the tear-streaked face of the small boy standing next to the woman, and her heart broke. Seeing that a manager was heading in that direction, she turned back to the task at hand, but she couldn't focus. She slumped forward with her head in her hands. She's been feeling really stressed and burned out lately. Her family and her friends have all been worried about her, and Erica can't help but agree. She thought she was following a lifelong dream to work in veterinary medicine. But some days, she doesn't know how much longer she can take it. Erica represents anyone working in the field of veterinary medicine, and each of the situations I've just described are happening in clinics across our country every day. For people who don't work in the field of veterinary medicine, there's a tendency to believe this is a dream come true, the most wonderful job, days filled with wagging tails, furry head bonks, and sandpaper-lick kisses. But the field of veterinary medicine is currently facing a crisis in mental health and well-being. Veterinarian deaths by suicide occur at more than 3 times the national average. That's higher than other healthcare professions in human medicine. 7 out of 10 veterinarians have a friend or colleague that has died by their own hand. 2 out of 3 report a history of depression, and 8 out of 10 describe this occupation as stressful or very stressful. And there are high rates of mental health stigma in the field, which prevents treatment seeking. And that's where my work begins. I wanted to help people who help pets. My name is Mary Beth Spitznagel, and I'm a clinical psychologist who works in the field of veterinary medicine. Together with my colleagues, Alana Updegraff, another clinical psychologist, veterinary social worker Lisa Weiborg, and veterinarian Meg Sislak, we've developed Unburdened.online, a website that delivers an evidence-based stress-reducing program for people who work in veterinary medicine. We started our work by talking to people in the field, asking them about the challenges they face. And one theme that kept coming up over and over was that of the difficult client interactions. It turns out, when people are stressed out about the sickness in their pet, there can be a tendency to behave in ways that are kind of in turn stressful for the veterinary healthcare team. Sometimes that's just the sadness or grief that's inherent to clinic work. Sometimes it looks like hemming and hawing and indecisiveness over treatment, or not following a treatment recommendation that you know is the best opportunity for a good outcome for that animal. Sometimes it looks like lashing out in anger, acting entitled, or refusing to pay for services that have already been provided. We've come to call this burden transfer, when the burden of the pet owner transfers to the person working in veterinary medicine through these difficult interactions. But what's really interesting is it's not just about how often these difficult interactions occur. It's more about the reaction that the individual has in that situation that really predicts stress and burnout. And that is key. Because it would be hard, probably impossible, for us to change the behavior of every pet owner out there. But what we might be able to do is give people working in the field the tools they need to buffer themselves against some of the stress that's walking into their clinic at the other end of that leash. We created a program that uses acceptance and commitment training tailored specifically to these burden transfer moments in veterinary medicine. We're helping people in the field better identify when these situations are occurring, and we're giving them skills to deal with that and better cope with the stress. Every individual who completes our program leaves with an individualized plan to deal with the areas of burden transfer that they struggle with the most. And by delivering our program directly in veterinary clinics, we're able to get around some of the treatment reluctance that comes from mental health stigma, which is high in the field. And our program works. We are significantly reducing stress and burnout in people who work in this field. The impact that we're having on people's lives is even more plain to see in the words of our own participants. For example, Andrea, who's been a veterinarian working in the field for 16 years and was close to walking away. She said, "At the time of the workshop, I was 100% burnt out. I'm so thankful to have attended to get actual tools that turned everything around. I've adopted what I learned into my work life and my everyday life, and the difference has been enormous." Now, when we first started our work, we were working in small, interactive group formats. But we knew if we're going to help a lot of people, we need to change things up a little bit. So we created a self-paced version of our program that can be delivered at the click of a button. Partnering with nationwide veterinary groups, we rolled our program out and were able to demonstrate that this self-paced program works as well as the original. We're reducing stress and burnout in up to 90% of our participants. We're now working to make our program available to everybody in the field. Through our continued efforts, we are helping people who help pets. A lot of people, like Erica, have benefited from using our program, and you can too. If you are somebody who's working in the field of veterinary medicine and you want to learn how to leave some of the stress and burnout behind, click on the link at unburden.online.